Okay, Mr. Parkers, there's just a few things that I wanted to go over with you today before I leave. So I know that you said that you have been experiencing some pain, and we did give you some acetaminophen to help with that pain. But one of the things that I did want to talk to you about was non-pharmacological ways to help reduce your pain and discomfort. So we did this thing called guided imagery, where you just picture your favorite place, say it's a beach, Hawaii, wherever it is, you close your eyes, and it kind of just takes your mind somewhere else and just makes you escape from that pain for just a little bit. So can you tell me where your favorite place is? The beach? Okay, so if you close your eyes and just picture the beach, that might help distract you from some of the pain that you are experiencing. So you do have a little bit of edema in your legs that I assessed today, so it's really important to keep your legs elevated just to kind of help get some of that fluid off of your tissues, because it is a little bit of a discomfort. So we do want to try to get some of that fluid off. And also it does help prevent venous stasis, which you are laying in bed sedentary, so we want to get up and we want to ambulate, and we want to elevate those legs just to get some of that blood moving, so we can prevent some blood clots. Also, you are taking furosemide to help get some of that fluid off of your legs as well. So it's really important that after we do administer the furosemide, it's going to make you have to want to use the bathroom right away. So it's really, really important that you use your call bell and you let us know when you have to go, so we can help you get up and get to the bathroom safely, prevent some falls. Also, you are experiencing difficulty breathing. So that thing over there on your side table is called an incentive spirometer. So it's really important that we use that a couple times during the day. Say if you have the TV on and a commercial comes on, it's really important that you use that. So I'm going to demonstrate here how to use the incentive spirometer, and then I want you to show me how to use that as well. It's also really, really important. You do have some secretions that you are coughing up. So one of the things that's going to help get those secretions coming up and will help you breathe more easily is cough and deep breathe. So can you explain to me what are the two things that are going to help your lungs and help you breathe better using the incentive spirometer and then cough and deep breathe? Yes. Also, we do want to keep ambulating and keep moving. This is also going to kind of exercise your lungs. We want to get those lungs working because they are filled with some fluid right now, so the more ambulation that we do, the better. It's also really important that when you do ambulate to take rest periods as well. Also, you are on a low sodium diet, so when we are picking out our meal choices, and even when you get discharged and go home, it's really, really important to keep in mind that a lot of things do have sodium in them. So if you look on the back of the can or whatever that you are getting to eat, it's really important that we keep that sodium level to 2 grams a day. And also when you're cooking, it's really helpful to use like lemon juice and fresh herbs and spices to help flavor your meals and not adding extra salt. So also it's really important to increase your fiber as well as ambulation that I already had discussed with you. Increase some fiber in your diet to help prevent constipation. We want to increase the mobility in your intestines because we are laying in bed most of the time. It kind of decreases your mobility, and it can cause constipation and a whole lot of other things too. So what we want to do to help prevent that is to increase the fiber in our diet and get up and get moving. It's really, really important that we do also turn and reposition ourselves every 2 hours or so, because the more that we lay in bed, the more likely we are to have skin breakdown, which could lead to pressure ulcers. So we want to prevent that, and how we do that is we turn and reposition ourselves every couple of hours. So can you state back to me what is really, really important to do to make a change in our diet? Yes, so we want to have a low sodium 2 gram a day, and we also want to increase our fiber. And then also, what can we do to help prevent skin breakdown while you're laying in bed in the hospital? We want to turn and reposition ourselves every 2 hours. Yes. Okay, Mr. Parkers, I am all finished with my teaching.